I wanted to do a video for anyone who may be in the process of getting set up for undergoing chemotherapy. I had to get a chemo port placed, which is this right here. And this is used so that whenever I have to get chemo treatment through the IV and also blood drawn, they're able to access my vein through this port. The port is implanted right beneath your skin, and then it's a tube that kind of goes up and connects into your vein. The procedure is an outpatient procedure. I got it done and I was awake. It took about 45 minutes to an hour. They do numb the area and give medications to kind of alleviate any anxiety. And there wasn't any pain at all during the procedure. I would say after the procedure, it may be a little bit sore. I did experience some soreness and discomfort, a little slight pain, but it was alleviated with over-the-counter medication. So it's not anything where you would need a strong pain medication to alleviate the discomfort. They provide you with a packet that they recommend that you take with you and have with you when you're out. It has the contact information for the doctor, the implant site, and the implant date. So I guess that's used in case of an emergency. So that way, if you are experiencing an emergency situation and you need emergency care, the medical providers are able to see that you have a plan and know where it's at, so that it's not bothered at all. So when you go to treatment, the doctor may prescribe you a lidocaine cream, which is used so that way before you go and have your port access, you're able to put it on the port so that it kind of numb the area. So this is what I use every time I have treatment. Before I go into treatment, about an hour before the appointment, I put the cream onto the chemo port site, and then I cover it with saran wrap. And then when I get to my chemo treatments, the staff takes it off, clears it, cleans it. And then they also use like a freeze spray so that it helps numb the area more before they access the site. And once they use the freeze spray and you had your lidocaine cream on the port site, when they access it, it might be a little pinch. It's not painful at all. It's no more painful than getting your blood drawn like you would normally do it. So I think it's more of a concern when you see it and you're not too sure what it's going to feel like. But if you use the lidocaine and request to use the free spray that the nurse has, then you should be good when the site is used. I had my port in place on a Monday and my first treatment was on a Thursday, so they used the port pretty quickly. I thought it would require more time for healing, but they didn't require me to have the port placed for long before it was used and accessed. So I'm going to show you how I use the lidocaine cream so that you can get an idea of what to do when you do get a port placement, so that way you're prepared and all numbed up before your appointment. So I usually take a glob and then I put it on the site. It doesn't have to be pretty. It doesn't have to be neat. Just as long as you cover the entire port. And again, this is what I do before my appointment. So before I leave the house, I usually try to make sure it's at least an hour before I have to go in for treatment. And then I use regular saran wrap. Doesn't have to be anything pricey. The saran wrap I get is from the dollar store. So as long as it's saran wrap, you'll be good. You want to take a piece of the saran wrap, and it doesn't have to be a large piece either. So this is about the size that I got. I fold it over. Then I put it on the port with the cream. Then I put my shirt over it. And then whatever other shirt I'm going to put on up over top of the tank top that I have on, I'll put it on and I go about my day, get into my appointments. And The nurse removes it and cleans it, and you are ready to go. So again, the port placement, I was definitely worried about it when I was informed that I had to get the port, just because knowing that you have to have a device that's placed under your skin that you have to have throughout the entire process is a little nerve-wracking, and then knowing that that you're gonna be awake during the process makes it even more worrisome. But again, the process was quick. It wasn't bad. The healing process was pretty straightforward. Taking over-the-counter pain medication to alleviate some of the pain and discomfort. Didn't have to have any type of follow-up appointments after the port was placed. And if I had any questions, I was able to speak to my oncologist just to make sure everything was healing properly and there was no concerns. And my team was pretty good with that. So once it's completely healed, you kind of go about living life the way you normally would. You can go swimming in a pool, taking showers. There's no real limitations as far as those things are concerned. One of the things that I did have to adjust is how I sleep. Just because I usually sleep on my stomach with the port placement, I try not to do that because I don't want to do anything that's going to move the placement or require me to have to get it redone. So I usually sleep on my sides or on my back, but that's not anything major. So just wanted to do a quick video. Hope you are doing well and continue to keep a positive attitude. Trying to kind of just take things one day at a time. There's going to be roller coasters. Your emotions are going to be all over the place, but taking it one day at a time, you'll get through it.